Welcome, sir. Welcome to Bauer. So I was just telling sir about what we've been doing and how we scaled about say 100 startups within Bauer, including all the verticals that we have. After looking at his journey, one thing is apart from his excellence in the healthcare, also a lot of things to kind of learn is about his entrepreneurial spirit, and also day in and day out he talks about why skills are important more than the degrees and all of that. Today we'll keep the session quite candid. We'll have more interactive, open forum and all of that. But let me take the privilege to ask the first question on how did he start KIMS? Probably being a doctor to what made him to get into the entrepreneurial venture also. Sir, if at all you can set the context of your entrepreneurial journey, that will be really inspiring for us.
So, three important aspects where this entrepreneurial journey has come. One, there was in my village, this is 1970s, 60s, there was only RMP doctor. He was well respected because he never bothered about the money. He goes and gives treatments and all. So I thought this is the best profession. Second, when I joined medical college, my sister had a heart problem. So we could not able to have the money to get it done. One. Second thing is the facilities are not there in the next 300, 400 kilometers away from my village. So then I thought medicine is these two reasons, medicine is the best. When I entered into the medical school, and then when I went overseas in Australia and all, I saw the vast difference between Indian healthcare and overseas healthcare. So I thought we want to be an entrepreneur. That is the things which decides to.
Wow. I think he identified a problem between Indian healthcare and the overseas healthcare, and he came up with a solution for that.
As I mentioned, initially we didn't have 5,000 rupees to get it done, the heart surgery. And she crippled, she became hemiplegic because of the stroke. She is still living with the stroke. And really we don't have money there. So I have an ambition to build that we need to be an entrepreneur. To do that, there is no way I can able to do. So that's why I have to get my degree, upgrade, skill, improve. Because at that time the cardiac surgery was not happening as it is happening today. I need to go to overseas to get well trained. After coming back, then it is a big teamwork, unlike other medical professions. It's not just like a clinic, it's a big teamwork. We need a cardiologist, intensive care, operation theatre, perfusionist, many people. It's where then I thought I will be able to work in one hospital. So I started my practice in Medwin. After 5 years of my practice, then I made a little bit of friends and other things, some finances. Then at that time my ambition of giving an affordable, accessible, quality care, which we could not able to provide in Medwin. So then I moved on to a trust hospital on my own in Mahavir Trust. At that time I could able to invest 5 crores of borrowing some loans and other things. And after establishing, then it was a very, very successful venture with no time. Then my original idea of going back and establish my own town of a multi-specialty hospital, that's why I started when I was working here. And then I started my hospital in 1999 in Nellore, which is a 200-bedded hospital. And that was the entrepreneurial journey started. And every weekend I used to go there and practice and do the administration. And I used to work Monday to Friday here. When that took off well, that encourages me to build more and more. Then every year we used to build one after the other, one after the other. That's how it is.
Probably I'll ask on the entrepreneur's behalf, sir. So because we are talking about the cardiology and all of that, wanted to check, often entrepreneurs, we all go through a lot of stress. And these days, I mean, last year, there was a data that about 200 plus entrepreneurs, they succumb to death because of cardiac arrests, right? So, of course, we all go through a lot of stress and all of that. But what could be, certain best practices that often entrepreneurs go through? and also with dealing this kind of anxiety, stress, uncertainty, and all of that. Probably one tip from you will be very.
I don't believe stress is there at anywhere. Stress, my personal definition is a mismatch of what you think, what you perform. If you are very clear what you are planning to do,
Yes.
then stress does not exist at all. When you don't know what you are going to do, then every day it is a stress. Like simple example, when all of you go for schools, exams, when you start from your first day of school or college till the exam day, you are supposed to do what you are. If you do, you don't feel any stress in the exam. If you want to study only in the last 1 month,
Yes.
then you need to have all products, tea, all these things. So whatever the one word you need is whatever you want to do from day one till end, till you achieve, you need to be, you are supposed to do what you are supposed to do.
Right. I think I got an answer for that. Right. So.
How important do you think it is for entrepreneurs to have a significant level of experience in the field they want to go into? I mean, you started as a doctor, and it takes so much time and effort to become a regular doctor, let alone highly specialized fields like you have. Do you think most of us entrepreneurs will need to also put in similar levels of effort to get the education and the experience required, or do you think that's often not needed for these forms of entrepreneurship?
See, there are two varieties of entrepreneurs. One, highly educated entrepreneurs. One, there is no education at all. So these are all, these two people are very, very successful. Both of them has a common factor. The uneducated person doesn't have any money. Even a highly educated person also doesn't have money. They choose in a different pathways. Both are successful, highly successful. See, basically what you need to have to be an entrepreneur, you need to have a irresistible desire and passion. Yeah. That's where when you start in the first day of your college till end, if you have the passion and desire, you continue to move on that. So that has to come. The second important thing, when we look into the society, as I mentioned about two variety of people, for every area there are empty number of entrepreneurs. If you look into the so-called supposed totally uneducated entrepreneurs reaches sky, plenty in Hyderabad itself. Your Ramoji Rao garu, L.V. Prasad garu, your Mallareddy garu. Like that, there are so many people who started nothing. Okay, no education. Education, when they require, they got the degrees and other things.
Yes.
The passion, desire that they want to be an entrepreneur has built in very young age, at the age of 10, 12 years. And how we need to be able to, when you keep moving on out, they face lot of challenges. Every challenge, if they take it in a positive manner and overcome that, that is called knowledge. They gain with this knowledge. With this knowledge, that knowledge is the again capex for them. There is other variety of people like, even though there are lack of money like me, Nageshwar Reddy, Somaraju, even you take any field, like all the pharma industries today you take, they are all worked a pharma company called IDPL, Indian Drugs and Pharmaceutical Limited, which was there. That is totally gone. All the people who come out and started these things. Most of us also well trained in Nizam's Institute of Medical Sciences. So here, when you have the same design, desire, passion to build your own entrepreneurship, then you will become a leader of your own department. And that's why we call it as I and we. I is, the meaning for I is illness. The meaning for we is wellness. Okay? So when you start with I and you succeed in I, then you need we to become a good entrepreneur. When the good entrepreneur always go with all the people, they always feel this mind. If you always, after that also you keep on thinking I, they will never able to go beyond a level. So that's why we always, the entrepreneur should have the ability of, you need to prove yourself as an eye, then people will attract, and then you need to take along with you, then the entrepreneurial journey will become much more highly successful. That's what I have done when I proved myself in Mahavir Hospital and then in Nellore, then people have been realized. That's why when I want to do it in Hyderabad, and then many people have come and approached, and then I followed. Instead of me, if I set up, I only make all the money. That's why I asked all the people to invest and work so that everybody will be able to grow. That is the way you can able to, when you are doing the entrepreneurship, to start with, you need to prove and see that the way you work hard, the way you need to be able to spend your time, all those things, that needs attraction by other people, your colleagues. Once all of you come together, then there is no way you can able to stop. Growth is on its own. See, the A is nothing but whatever is the data, in, especially in medicine. I am not have so much of knowledge in A. What all the data that we have been put in, if you want to assimilate and get a results out of it, it will take weeks or months, but it will give in 2 minutes. So it will be a helpful tool, especially for medicine, but not all the time you can able to depend on AI. So it's personal experience is the most important thing. Sometimes person also, if you, for example, if I want to read a X-ray, AI will able to, every X-ray will entirely, there is a systematic way of reading. But in a human being, unless you don't see it, sometimes they may miss also because of their over enthusiasm or confidence levels. So AI will definitely in every field will help. That's why instead of artificial, it is an augmented intelligence. It will be able to help us. But at the same time, what I initially personally feel, education is nothing but sharpening of your brain. When you put a question, why, what, how, and then the brain will get better and better and keep thinking and giving more and more knowledge, and you get all the things. Today when AI comes, that education will go, the stimulation of brain has gone, everything is coming in front of you. So what we are planning to do few weeks, it is doing in few minutes. Definitely AI will improve, but it is not ultimately that can, there are many people who says AI doctors are come, it will be able to do everything and all, but human touch is always has to be there. See, initially when I don't have that money to start a multi-specialty hospital is a tough job, where I am good at it in cardiac surgery, in cardiology. So I can able to control each and everything, not only doctors, the paramedics and everything, so that I can able to provide a good quality care. So after setting that, then you face a lot of challenges. Some of the patients do require some neurological counsel, some dialysis, some CT scan, some other specialty support. At that time when I want to call, the people used to take their own sweet time to come and treat the patient. So the time is very, very missing. That's why single specialty may not be helpful. So we want to move on to multi-specialty. That's why my first hospital also after Mahavir, then I moved on to multi-specialty. Since then we are all in multi-specialty. So no, the entire thing we are now moving on to AA. AA is helping a lot of certain portion of medical things. Like suppose for example, we have an MRI. Previously we used to do a cerebral stroke that comes. We used to have a window period what we call as a 4 hours. Within the 4 hours, if you can able to do something, if the patient come with the paraplegia, that is paraplegia means, or hemiplegia, one upper and lower limb will be totally paralyzed, unable to walk, unable to speak, unable to hand, eat, mouth and all. And then after 4 hours, that period is over, whatever you do, it is a cripple for lifelong. So now with the AI that has been identified up to 8 hours, if we can able to give the treatment, we can able to see still there is a viable brain tissue is there. When you are able to reperfuse the blood, immediately the patients are walking away from the hospital. Not that before AA it was not happening, it was happening within 3 to 4 hours. At the end of 4th hour, if it is time is done, we never even put our mind to try to give this type of things. So now with the help of AA, we can able to do. Similarly, like suppose there is so much of precision has come in the AA, where we have our own hospital, a magnetic resonance focused ultrasound, where the patients do get like of treatment of tremors like this. There is no treatment at all. Now today with AI focused, we could able to see and go to the brain and see where the tremors are started. We ablate that, the tremors will disappear in 2 minutes. And a lifelong it's a good boon for him. Otherwise, you would not have to socially move around all those things.
Sir, since we are talking about AI and also we are talking about the skills, what could be the 5-6 skills that will be completely irreplaceable? And for example, probably we are talking about the human skills again. There should be a human touch, is what you are saying. Correlating to that, what could be 5 skills that you rate that all of us should be having? Probably people at a younger age also they'll start developing those skills.
My life experience, actually, I created about 7 important aspects each and every one of you should know. The 7 A, B, C, D, E, F, G, okay. Which most of the, I feel, educated people doesn't know. A is attitude, and anybody who thinks positive attitude, their entrepreneurial journey is much, much superior, better. And second important thing is B for budget. Okay. Which nobody knows, many people. That is basically the education. The education is supposed to teach 2 things. One is how to make money, which they are not going to teach anything in the education system. So this budget, if people know, so all of you, whether you want to be an entrepreneurial journey, whether you want to run a good, your house, your education, your day-to-day living, budget is the most important thing that we need to be able to learn. The C is either what you call as a civic sense, common, and then communications, all those things. All the educated people try not to follow civic sense. All the uneducated people, they follow civic sense. The one simple example, if we all follow civic sense, we don't need a policeman near the signals. You have toured anywhere in the world, any developed country, there will not be any police person in the signals. So that means we mostly, see, in the villages there is no signals and also they will follow. Here even the villagers comes, if there is a red light, they will stop. But we never. We are educated, I should be able to overcome. We always try to, our education, we are using it in a wrong sense. How to find out the loopholes and get. So the D is, you can able to say discipline, dedication and everything. The most important thing which we don't have, which supposed to have, is dignity of labor.
Irrespective of the designation, we...
So the most important thing, any entrepreneur should have the dignity of labor. So that's how all the Western countries, the government worries. If there is a 1.5% unemployment, they worries. Here we never bother about worrying about. So that's why they will start earning and then they learn. So that's why earning, then they start learning. We start parents' money, learn, don't learn anything, but we are pretending we are learning something, and then we will come to that. Then we will be parasites for any number of time. So 98% of the people are self-living because they know the dignity of labor value. We are only 30% earning members and 70% are parasites in this country. That's how country is not able to. The E is empathy. which most of us have sympathy but not have empathy. So when we have all these 5, A, B, C, D, F properly, F is fruits of work. Whatever job you do, you enjoy if you follow with all these things. The last one is the G. G is governance, which we never follow. And most of us doesn't know what is governance also. Every day we hear from state government budget, every central government budget, but we never know what is budget. Even we know, we never follow the budget. So the entire important thing out of all these things, the most easiest thing what I felt is making money is the easiest thing. What is the difficult thing? Huh?
Sustaining that.
Yeah, retaining the money. So for that, all of you I am telling, why I tell budget is the most important. If you save 10% of your income and invest from when you start earning, from that day, 10% you save and invest, 90% you spend whichever way you want, every one of us will become multimillionaires, every one of us, including a class 4 employee. The developed countries, dignity of labor, all these people, they do. In India, what we do is when we get 100 rupees, next year I am going to get a 10 rupees extra increment, so I borrow another 10 rupees, spend this year. Okay? So that's why we go into a debt trap. That's why corruptions will come, all these things will come. So whenever what I always feel, education is nothing but these 7 things. The rest all things what you studied will never stay with you, but these 7 has to stay with you permanently. Thank you very much.
Thank you.
Thanks, Kamal, for inviting.